Now John, I'm just going to go through giving the medication through the peg feed with your wife. Is that alright? I'm just going to have to pull down the covers just to show her. Is that okay?
Alright, Mrs. Murphy, so first things first, before we administer the medication, you need to make sure that your hands are clean. It's important when administering the medication that you double check what medication is due, that you have the correct medication, it's the correct date and the correct dose and the correct time. Okay? So you will crush his medication using a crusher. I have it pre-prepared here. And then using a 20 ml syringe, you'll draw up some of the sterile water, 20 ml, and add that to the crushed medication, leaving time for it to dissolve. Okay? Then, what you need to do, as his feed is going through, you will need to turn off his feed to allow us to administer his medications. It's very important, Mrs. Murphy, that when John is having his feed or giving his medications, that he's at a 45-degree angle to prevent it from entering his lungs. So I'm just going to pop on a pair of gloves. Now, we have turned off his feed, and these are the two important valves. So his feed is being administered through this valve, which has now been stopped. So we will be administering his medication via this one. So firstly, we need to flush out the feed that is going through. So using my sterile water and my 50 ml syringe, I draw up 50 ml of sterile water. It's very important to make sure that there are no air bubbles in the syringe. Now, once you have the 50 ml of sterile water drawn up for the flush, you open the valve and using a very slow pressure, light pressure, you flush the peg feed. Is that okay, John? Have you any questions so far, Mrs. Murphy?
No, none so far, thanks, nurse.
No problem. It's important that this goes through slow.
And there wouldn't be any pressure going against or anything?
No. Maybe a slight bit at times, but there shouldn't be any pressure. So once that has gone through, it's important that between each administration that you close the valve again to prevent bacteria entering and prevent infection. So I've that flushed now. There's no more of his feed left. So I'm going to use my 20 ml syringe. His medication has been dissolved, and I'm going to draw up his medication. Once again, it is very important that no air is in the syringe. For the 20 ml syringe, you need to use the smaller valve here on top. So once again, light pressure and administer it slowly. Is that okay, John? All of this equipment you'll be getting from your public health nurse anyway, okay?
Okay.
And if you have any worries, they'll go through it all with you.
Okay, thank you.
Now, this medication has gone through. Once again, you're going to close off the valve. Now, it's very important, the final step is another 50 ml of sterile water to flush the tube. Now that makes sure that all the medication is gone from the tube into John, which makes sure that he's getting all of his medication. And once again, no air bubbles in the syringe. open, report. And slowly and light pressure, you flush. And that is that. Now, would you like to have a run through of that, Mrs. Murphy?
I would, nurse. I'd like to give it a try maybe, but you supervising me if you wouldn't mind.
That's no problem. We've one more medication to give him here, so what I might do is just let you practice doing the flushes. All right?
Okay.
Have you any other questions before we start?
No, I don't think so.
Very good.
Thanks,
All right.
nurse.